For some people, sleep apnea seems like a slight inconvenience. They might not even realize they have it, while for others, it's a nightmare. Either way, it's important to understand the long-term impact it can have on health, because studies show that sleep apnea can increase the risk of stroke by 60% and the risk of heart failure by a staggering 140%. But despite this, many people ignore the symptoms. Snoring, suddenly waking up in the night, difficulty concentrating during the day are often dismissed as mere nuisances or attributed to other causes. But what's really happening can be very serious. So, in today's video, we'll explore the link between sleep apnea and heart disease. We'll look at the science of what it is and why it happens, symptoms to be aware of, and why these issues should not be taken lightly. Plus, we'll unveil some practical steps to address it, including a fun musical technique that showed great results, as well as expert tips for better sleep, whether you have apnea or not, to get the deep rest we all deserve and be the best versions of ourselves. But before we jump in, can you do us a favor? Click on the thumbs up and help us spread the word about heart disease prevention. And ring that bell to stay up to date with our latest videos. We want to make sure you get the latest info so you can live a long, healthy life. And stick around to find out how to get 2 heart healthy free gifts. We guarantee both you and your heart will love them. Do you ever wake up feeling exhausted, even though you're sure you slept through the night? That's one potential symptom that millions of people grapple with, often without even knowing it. So, what exactly is sleep apnea? Picture this: you're sleeping peacefully, then suddenly you stop breathing. That's sleep apnea, a condition characterized by repeated interruptions to breathing or shallow breathing while you sleep. The science behind sleep apnea is fascinating. The most common type is called obstructive sleep apnea, where the muscles in the back of the throat relax too much, the throat narrows, or the tongue blocks the airway, obstructing the flow of air and causing breathing disruptions. Snoring is a good example. When oxygen levels drop, your brain triggers an alarm in the form of stress hormones. These hormones are like a mini jolt of energy, shaking your body out of its slumber to clear that airway and get you breathing again. It's amazing. It's your brain looking out for you. But here's the catch. Yes, you're breathing again, but at the cost of deep, restorative sleep. For some people, this happens between 5 and 30 times per hour. You may not remember waking up, but you certainly feel it in the morning. And over time, the frequency of these episodes can increase, causing havoc in the body. At a top level, these interruptions cause systemic inflammation, damaging blood vessels and contributing to cardiovascular diseases like atherosclerosis. Moreover, the constant fluctuations in oxygen levels cause stress to the heart as it works harder to pump blood, all contributing to high blood pressure, blood vessel dysfunction, heart failure, artery disease, and stroke. Furthermore, studies show that sleep apnea may contribute to heart rhythm problems, including arterial fibrillation, non-sustained ventricular tachycardia, and ectopic ventricular beats. Essentially, it messes with your heart and whole body in the long term. But taking a step back, whether it's sleep apnea specifically or something else, any regular sleep interruptions can have serious implications. From heart disease to depression, sleep issues are an unseen force behind a host of health problems. For example, researchers at Columbia University found that relatively mild sleep problems can damage endothelial cells, which significantly contributes to the development of cardiovascular disease. Now, that study was looking at mild sleep problems in general. As for sleep apnea specifically, studies show that without adequate treatment, people with sleep apnea are twice as likely to suffer heart attack. Therefore, it's incredibly important to get on top of these problems. Okay, so far we've talked about the most common type, obstructive sleep apnea, or OSA, when the airways become obstructed. But there are two other types we should discuss: central sleep apnea and complex sleep apnea. Central sleep apnea occurs when the brain fails to transmit signals to muscles that control breathing, specifically the diaphragm and intercostal muscles in the ribs, the muscles that contract and push air out of the lungs. Unlike obstructive OSA, CSA is caused by communication breakdown between the brain and the muscles, rather than a physical obstruction. With CSA, people may also experience similar symptoms during the day. Taking it a step further, complex sleep apnea, also known as mixed sleep apnea, is a combination of the two other types, meaning a person has both physical airway blockage plus failure of the brain to control breathing, making it a very difficult problem to treat. Like the other forms of sleep apnea, this can lead to trouble sleeping, snoring, fatigue, morning headaches, irritability, a dry mouth in the morning, and difficulty focusing, as well as serious conditions like high blood pressure, heart disease, stroke, and diabetes. Okay, that's the heavy stuff. Now to the good news. The good news is that we're living in a time of innovation and advancement. Beyond lifestyle factors, which we'll get to in a moment, researchers are constantly uncovering new ways to understand and treat sleep apnea. The traditional therapy is called continuous positive airway pressure, or CPAP. This involves wearing a mask over your nose while you sleep, which delivers pressurized air into your airways to keep them open. Classically, these machines had some problems. They're not suitable for everyone, and they can be uncomfortable. However, there have been advancements over the years, making the devices easier to use, such as smaller and quieter machines, and more comfortable masks. Studies show that CPAP can significantly reduce symptoms, which is why they're the treatment of choice. New technologies are increasingly available, such as a method called upper airway stimulation. This works by stimulating the hypoglossal nerve with mild pulses of electricity, keeping airways open. A stimulation electrode is surgically implanted in the tongue, and breathing sensors are implanted in the chest, somewhat similar to a pacemaker. Early trials show great promise, with a 2018 study finding that this nerve stimulation method reduced apnea-hypopnea index scores by up to 68%, with patients reporting reduced apnea effects and an overall improved quality of life. Finally, we have molded dental devices, low-tech options that fit inside the mouth, like a mouth guard. These work by either pushing the jaw forward slightly or retraining the tongue, depending on the specific design. These devices have had mixed results, working well for some people, while not so well for others. Now, let's shift a gear and look at broader preventative approaches. An outside-the-box example is playing the didgeridoo. Yes, you heard that right. A study published in the British Medical Journal found that playing this wind instrument can help reduce sleep apnea. Researchers found that blowing into the didgeridoo helps strengthen the muscles in the upper airway, making it less likely to collapse during sleep. The study found that practicing the didgeridoo had positive effects on daytime sleepiness, the apnea-hypopnea index, and sleep disturbance reported by partners. This may apply to other instruments, but the didgeridoo is what they studied. If you're not musically inclined, no worries. There are other simple exercises that can make a big difference. Before we move on, Heart Disease Code would love to give you a free book, The Surprising Truth About Fat and Cholesterol, plus the first episode of the untold story of heart disease, something that everyone concerned about heart health should watch. Click the link in the description below to claim these free gifts. Okay, let's get back to the video. So, the overriding point here is that early detection and intervention can significantly reduce the risk of health problems associated with sleep apnea. Just like any medical condition, the sooner you address the problem, the better the outcomes will be. And as we've discussed in many of our videos, heart disease is something that progresses over time, often with no major symptoms. So if you suspect that you or a loved one might be grappling with sleep apnea, if you experience chronic snoring, choking or gasping during sleep, long pauses in breathing, daytime fatigue, dry mouth in the morning, and difficulty concentrating during the day, don't dismiss it as mere inconvenience or a nighttime quirk. A simple conversation with a healthcare provider can make the world of difference. Finally, we have the golden rule of heart disease, which also directly impacts sleep apnea and other sleep problems. Maintain a healthy lifestyle. Obesity is a major risk factor for both sleep apnea and heart disease. You may already be aware that a BMI of 30 or above carries numerous health risks, including increased risk of heart disease, but its role in sleep apnea is equally troubling. Research indicates that even a 10% increase in body weight can raise the risk of sleep apnea by a staggering 6-fold. Research shows that neck fat can play a major role. Increased fat deposits in the neck can narrow or block the upper airway during sleep. But it's not just the physical obstructions that causes problems. Obesity leads to biochemical changes that also increase sleep apnea risk. For example, obesity triggers inflammation and an overproduction of the hormone leptin. Both of these factors disrupt sleep and breathing patterns. Obesity also plays a role in insulin resistance, a precursor to diabetes and a condition that exacerbates both sleep apnea and heart disease. What's more, obesity leads to oxidative stress, an imbalance of harmful free radicals in the body, which damage cells and tissues, including those in your heart and respiratory system. This oxidative stress, in turn, speeds up the formation of fatty deposits in arteries. With all of these interconnected issues, it's easy to see how obesity, sleep apnea, and heart disease create a vicious cycle. But there are many steps you can take to reduce your risk. A major aspect, exercise. Regular physical activity improves cardiovascular health, lowers blood pressure, and helps to maintain a healthy weight. Not only can a regular exercise help prevent sleep apnea, but it can also improve the quality of sleep for those who already have the condition. Limiting alcohol intake is another crucial step. Alcohol can relax the muscles in the throat, leading to more frequent and severe episodes of sleep apnea. Additionally, alcohol can contribute to high blood pressure, obesity, and various types of heart disease. Likewise, smoking causes inflammation and fluid retention in the upper airway, worsening sleep apnea. Eating a healthy diet, full of whole foods, less processed foods, and less refined carbohydrates also makes an enormous difference. We have plenty of other videos on that topic. Finally, good sleep routines are crucial. That means maintaining consistent sleep schedules, creating a sleep-friendly environment, a good mattress, and a wind-down routine. Something relaxing like reading a book, staying away from screens, signaling your body that it's time to wind down. To conclude, if you experience symptoms like chronic snoring, choking or gasping during sleep, long pauses in breathing, daytime fatigue, or difficulty concentrating, consult a healthcare provider and take the proactive steps we discussed. Prevention is always better than a cure. We really hope you found this video useful. Leave a comment with your thoughts. We love reading them. Share your own life hacks and tips for others watching. And remember to get your 2 free gifts: the surprising truth about fat and cholesterol, plus the first episode of the untold story of heart disease. Click the link in the description below to get them. Like this video and click the subscribe button so that you can stay up to date as we release new videos. Thank you so much for watching. We hope you have a happy and heart-healthy day.